Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, in this episode I sit down with Jen Repac, Cara Amstutz and Leilani Alvarez to discuss their new textbook, the Handbook of Canine Exercise. Now, exercise therapy is one of the most powerful tools in veterinary rehabilitation, yet is also one of those areas where therapists can make big mistakes. We dive into some of the common pitfalls clinicians encounter when prescribing and progressing exercise programs, and how this practical resource can help therapists make better clinical decisions and achieve improved outcomes for their patients. We also go behind the scenes of the book itself. Jen, Cara, and Leilani share what inspired them to create this comprehensive guide, the challenges of collaborating on a textbook, and the enormous undertaking involved in bringing such a project to life. Now, if you're not already a member of one of our amazing online communities of vet rehabbers from all over the world, we gather in our Facebook groups. So if you haven't joined, head over to Facebook and request to be a part of the action. Our groups include small animal vet rehabbers, equine vet rehabbers, hydro vet rehabbers, and our business vet rehabbers. That's for the one of those people that are juggling patient care and running your own practices. We regularly share tips, advice, and host live sessions with experts to support you on your vet rehab journey. A quick word from our sponsor. Support, prevent, and rehabilitate. That's Paul Prosper's way. We've built a portfolio of industry-leading brands like Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, and Blue Nine to give your patients the gold standard in care. And we have some big news. Paul Prosper is officially the new home of the Canine Rehabilitation Institute and Onlinepethealth. We're bringing the best products and the best online education together under one roof to help you and your patients thrive. As a special hello to the Onlinepethealth community, we're offering a one-time gift with your next order when you sign up today. Head over to paulprosper.com/OPH and join the movement in pet rehabilitation. Right, over to my chat with Cara, Jen, and Leilani. Hey, vet rehabbers. Today we got Cara and Leilani and Jennifer. Welcome, everyone.
Hello there.
Thanks so much for having us, Megan.
I'm so excited to chat to the three of you. And I think I've actually had each of you on the podcast, but individually. So it's really, really, really cool to have all three of you together. We're here today to talk about your book, The Handbook of Canine Exercise Therapy. So before we chat about it, I think it'll be great if each of you could just introduce yourself and just chat about what made you think about starting to create this textbook.
Okay, I'll start. My name is Dr. Cara Amstutz, and I am a board-certified sports medicine and rehab specialist. I have a small pain management, rehab, mobility practice in Southwest Missouri, and then I'm also one of the lead instructors and the director of clinical education for Canine Rehab Institute.
Thanks, Cara.
My name is Jennifer Repac, and I am an assistant clinical professor at the University of Florida's Integrative and Mobility Medicine Department. And I'm also board certified in sports medicine rehabilitation for canine, and also do some side gigs at the Chi University where I meet rehab practitioners now and then.
And I'm Dr. Leilani Alvarez. I'm the director of the Integrative and Rehabilitative Medicine Department at the Schwartzman Animal Medical Center in New York City. We're a big facility. We have over 150 veterinarians. I had the pleasure actually of having Dr. Repac as my first resident of the program here for sports medicine and rehab. And she actually approached me after a lecture that I think all of us have had people ask us questions, what resource can we go to for exercise therapy? And Jen called me one day and she's like, I think we should write a book because there isn't a resource. So yeah, so here we are. We wrote the book. Thanks to Jen.
That was my next question is how did the three of you get together and how was it decided we're going to write this textbook? So how did Cara get in on the textbook?
That was me.
Is that you?
Yeah, when Jen approached me about the text, first of all, you should know that the answer I gave her was no way. I'm not qualified to write a book. And then when I started to really think about, okay, we're going to do this, I said to Jen, I think we should get Kara in to help us because Kara had newly acquired CRI. She was the new CEO, and they have a lot of resources that are ready to go. And I thought that would be a really invaluable contribution to the book, and it sure has been.
So none of you have written a book before this.
No.
No,
Okay.
I think
Ignorance is bliss, actually.
we've written chapters, or I had written chapters, contributed to other people's books, but from start to finish, absolutely not. So it was a great learning experience for all of us.
Yeah. And how long did it take?
4 years. The book is as old as my child. So
Wow.
they had approached
That's a
me
long
when I was
time.
very pregnant and I was about to give birth, and I was like, well, I can throw together a proposal for you, but I'm going to be busy for a little bit.
Did you think it would be quicker?
Yes, we did think it would go quicker.
Oh, yeah.
And one thing that put us in a little bit of a time stall was I was in the middle of studying for boards. So I had to say, hey guys, I need to take a pause to do this. So that probably slowed us down a little bit.
Yeah, I think we all had.
Oh, go ahead.
No, I was just going to say that I know we delayed Wiley had a deadline for us, and at one point we delayed it a whole year for all individual circumstances. So some of it was on our end, some of it I think was publishing things, but for sure I think all of us agree it took longer. I think it's similar to renovating your home. You have in mind what it's going to be, and then there's all sorts of surprises, and it always takes much longer, and it's just very different than you envisioned when you first went into it.
Yeah. And you all did a really good job of keeping it a secret because I mean I didn't hear anything about it. Were you just hush hush about it for all 4 years? Or did people know about it and you just didn't keep me in the loop?
Just be, probably in our own circles. We talked about it, but we there's no like marketing that is done for these books, so it's kind of all up to us. So maybe that's a little bit on our own. Shows our own naivete as new book authors about not promoting it in advance. But yeah, I think actually one of the biggest things that I came to realize is that being on the other side, being a student, and you see a textbook on a shelf and you think that there's so much money in textbook writing and all this stuff, and it's really a labor of love entirely, and all these people who write chapters for the book, they're doing it without any sort of payment at all. So it's really a group effort, and really a labor of love to want to put out educational materials. You truly have to believe that you have something to contribute. And it's also hard, in that circumstance to get things moving swiftly.
I was just going to say, we weren't trying to keep it a secret, Meg, at all. In fact, the start of the year when we knew the book was originally was supposed to come out in January, and then that was pushed to March, and then finally it was April. And we were all very anxious because with VMX and Western Vet Conference, we wanted to promote the book. And we did. We full force, all of us. I mean, we spent our own personal money to make cards to market the book. And yeah, so we weren't trying to keep it a secret. It was certainly while writing it, I think the people that were most intimately familiar were the authors. So we have really, really amazing authors that we should call out to. People like Amber Urke and Alice, and I mean, we just have Cindy Otto. We have Joe Wachschlag, lots of really fantastic colleagues in the specialty college of sports med rehab that contributed to this book, including many people that I trained with. So Samantha Wong and Carrie Britt, who are also my residents, are also contributing authors. So yeah, I think I'm so proud of the end product that we have, but more importantly, it's been really amazing for me to see my colleagues come through in a professional way to now educate other people. It really is, it's such an honor.
So how many contributors in total?
Well, that's like a pop quiz question.
Do you know?
You know, I don't know the exact number off the top of my head. I would think at least 12 or so. I mean, there's some that wrote multiple chapters. There's 22 chapters in the book, but there are some that wrote multiple chapters. So yeah, I would say
Kara's
probably.
grabbing the book. I was going to
Yeah,
say,
there
let's
we
use the
go.
book.
Thank
It's a
you.
good question, Meg.
We also have
obviously-
a lot of new writers. Dr. Supanik, who is a physical therapist, also contributed a chapter on workplace ergonomics, which is something that is really in the rehab field, a topic that we need to be talking more about in order to create longevity in our field. Okay,
I think
answer.
Kara's got it.
Okay. 25 contributors, including the three of us, because we wrote chapters as well. So 25.
Yeah.
And
That's amazing.
and I love it because, it really, the folks that we had, that volunteered their time and their expertise are so wide in their knowledge base, so we pulled people who were experts in very specific things, like, Patsy Mish with her VOP knowledge. That is there's not much information out there about orthotics and prosthetics. And so taking that and adding the whole concept of exercise therapy with a patient in one of these devices just takes that knowledge base so much deeper than what's been out there. So really, really cool contributors. And I think that's what makes this book so cool, is that it's, it takes the rehab world and then it fine tunes it down to this particular therapeutic option, which I think those of us in the rehab community, we use this all the time, right? But this book is also made for general practitioners who maybe don't have this knowledge base to be able to pull from. And so it's really to help kind of bridge those gaps for everyone, so that exercise is not just something people think about as an aftermath. It's part of the prescription plan for a multimodal therapeutic intervention for our patients.
Leilani.
Oh, I was just going to add that one thing that was exciting for me is really delving into the evidence and things that I have been practicing, but hadn't really looked into what's the evidence for this. For example, here at AMC, I'm very lucky that our critical care team, patients in the ICU get referred to rehab all the time. So we go down to the ICU and we treat these critical patients. So we wrote a chapter on doing exercise therapy for critical patients. And it was fantastic to work alongside a board certified criticalist here at AMC and really learning about the information that we have on that. Also, there's a chapter on the developing dog, the working dog, geriatric dog. So we really tried to provide the latest evidence that we have in implementing exercise therapy, because I think the go-to is a modality, right? That's so easy and seems like you're not going to harm anything by, doing laser therapy. But is that where you're really going to get results? And, at least the data we have, even the limited data we have on the veterinary side, it's no, actually, it's the exercise therapy. That's the intervention that's going to really bring you results for all your patients, including the critical ones. And I'm so happy that we have a book now that can contribute to guiding the practitioner. And how do you approach that if you've never done that? But if you have a critical patient and you've never done an exercise program for that patient, where do you start? And that's, I think, what's really unique about this book is it's not time-based, it's really criteria-based. What criteria does your patient have to have? How do you assess the patient? You go from that assessment phase, determining the criteria, to begin a phase of an exercise program. And then how do you progress it?
Yeah, I mean, often I think in vet rehab, there's this tendency to sort of rely on protocols.
Yeah.
So what you're saying is this is sort of encouraging you not to follow any protocols, but to create your own exercise prescription from the actual patient.
It's actually, I mean, I know protocols are very helpful because when we start out, we need some kind of start, we need some kind of foundation, but it actually trains you to look at your patient and to assess your patient, and based on that patient assessment, it tells you what the next step would be. And so it is, you know, it's a loose protocol that it's kind of, but patient driven. That's the important difference.
Yeah, and I would say this closely follows the human physical therapy approach, which is that there is a protocol, there's a structure, but it's criteria based, meaning if you meet this criteria, then this is what you should do. Now that you've reached this next set of criteria, then that progresses you to this now. So there is a structure, which I think is necessary, particularly for an inexperienced practitioner, but even for the highly experienced practitioner. What I have found, we actually pull the book when we're rounding on patients, and it's wonderful because one of the really fun things about writing this book is we learned that the three of us do things differently. It's not surprising, and it gives you new ideas as a very experienced practitioner. If you pull the book, you're going to be like, oh, I didn't think about that exercise, and yeah, and actually, it's going to be great for this patient.
What are some of the other sort of more common mistakes that clinicians make when they prescribe or implement exercise therapy in dogs?
I'll take I'll take this one. I think as Leilani alluded to, over-reliance on modalities. I think that rehab has kind of become overshadowed by marketing. And you know, if you read, you know, a lot of these overview rehab books, you might think you need $150,000 worth of equipment to even get started. And you, well, if you don't have that, then forget about it. When actually the core of rehabilitation is exercise therapy. And something that I teach our veterinary students is that, you know, if anyone goes and has an injury and they go to a physical therapist, the physical therapist doesn't come at them with 100 different gizmos and spend an hour letting them lay there while they laser their shoulder or whatnot. It's exercise is the foundation, and while the modalities can serve as a complement, the real art to rehabilitation is in the exercise. That's where there's so much nuance, and that's also where you can go. You can go wrong in a variety of ways. You can progress too quickly and prescribe an exercise that is way too advanced for, let's say, like a newly recovering dog after surgery. And I've seen that done time and time again, prescribing, for example, a three-legged stand post hemilaminectomy. Probably not going to be very successful in a dog that can barely stand on 4 feet. Or in contrast, a dog that is, you know, maybe 2 months out of hemilaminectomy, walking relatively strongly, and then doing passive range of motion. And that exercise would be far too easy for that patient at that stage. So trying to meet the patient exactly at the level that they are at is something that is the real struggle, I think, when you are learning for the first time.
And I think that goes back to the assessment phase that Leilani had mentioned. You know, that is truly the secret sauce of therapeutic exercise, is being able to look at your patient and understanding the acuity of their injury or their healing process, and looking at what is their posture like, how strong are they, what can they do, what can they not do, and tailoring the exercise to meet where they're at, and then provide a little bit of overload at specific places to allow for improvement in strength or range of motion, mobility, all of those things. And that's, you know, at CRI, that's one of the things that we get feedback on. You know, I really wish you would give us a cookbook protocol for how to rehab a post-op TPLO, right? I mean, that's the most common thing that a lot of, especially new rehabbers, deal with is post-op stifle surgery. And the thing is, every post-op TPLO patient is different in their own way. And so you have to be able to put your hands on the patient, watch the patient, how it's moving, its pain level, and take all of that information and then create an exercise plan that's going to be of benefit and not hurt the patient.
Yeah, I couldn't agree more. And a TPLO patient is a great example because I think all of us have seen the obese, uh, completely lacking in condition TPLO dog versus you have the sporting dog who scores cruciate when they were already in excellent body condition and excellent level of fitness and stamina. You're going to rehab those two patients very differently. And what's nice about the book is it will guide you because you're going to meet those criteria much faster in that athletic dog who already arrived at the surgery table in a very different place than the obese lack of fitness dog. The other the other thing I wanted to add to what is one of the biggest mistakes practitioners make is not having the owner demonstrate the home exercise in front of you.
Mm.
That's a big mistake because even if you're following the criteria of what's appropriate for the patient, which absolutely you should do, it also needs to be appropriate for the owner. And that's something I really try to teach my residents is, we always talk about, well, what do we think will be the best exercise for this patient? Sometimes that best exercise for the patient is not attainable for the owner. And so making sure that not only you show them, you demonstrate the exercise, but then you say, okay, now you show me, and figure out if that's gonna if that's gonna be something that's doable for the owner in a home setting.
Yeah, I mean, owner compliance is one of the hardest things that we have, right? And as you say, there are some clients that, you show them the exercises and they're quite able to do them. And then there are others that doesn't matter how many times you show them, they're just not going to get it. Is there a chapter that covers like how to help you to improve compliance?
Actually, yeah. So we have the way our book is laid out is it's meant to be kind of in the order of sequence that you would see a patient. So it starts off with talking about, well, just a little bit of background about rehabilitation. Then we kind of go into how to collect a proper history, how to set up goals for the patient. And then Kara's chapters talk about the assessment of the patient. So how to do the exam, how to integrate your musculoskeletal neurological exam, and then that kind of flows into reassessment. So the other thing is you don't just set a plan, fix it and forget it and let your techs run off with it, right? So you actually need to reassess these patients. And then we talk about different outcome measures and how you can use outcome measures to verify if your patients are improving. And also I have a section about troubleshooting difficult cases and when to kind of circle back if what could be possible reasons why you're not having success in a particular patient. And then particularly also for in the athletic dog chapter, Dr. Baker does a great job at talking about how to talk to the handlers and also dealing with that relationship with the handlers as well. How to I actually particularly love there's a glossary of all these terms for the athletic dogs, and it defines all the terms that they use in the sports field so that you could kind of talk the talk with the owners as well.
Yeah, that was one thing I was going to add about on top of Leilani's mention about having the owners show you how to do the exercise, because we're not only worried about can the owners themselves physically do the exercise, but also some of these owners are really excited about adding some of the things that they may do with their dog when they're training, and they might add a little bit of intensity that is actually too much for that patient at that time. So sometimes we have to rein the owners back a little bit, especially these athletic dogs, and they're trying everything that they can to get this dog back to competition. So we have to guide them in all the directions.
Yeah, it's the full spectrum, right? We get owners who want to do the very best for their pet, but they want us to do it. They're like, okay, well, we'll bring him 3 times a week for you because I can't do any of it. To the owners that they overdo it, and I think those are usually the athletic dogs. They're competing, and the owners are just so excited to get them back to sport. Yeah, and somehow as the authors of this book, we're trying to guide the practitioners and how do you provide that advice for the various types of patients that will present.
Not having grabbed my hands on one yet, and I'm hoping to get a signed one. I'm hoping you're all going to be at the IA VRPT conference, so I'm hoping to get a signed one from all of you. Um, Are there like instructions exactly how to do the exercises with some links to videos and things like that? Can you just describe sort of what it looks like inside the book when we're looking at all the different types of exercises?
Yes. So what we did was, as the authors were submitting their chapters, we kept a running list of all the exercises that they described. And then at the end of the book, we have an appendix that has each exercise, the name of it, the how to perform it, how to progress it or modify it. And we also have it color coded based on how difficult they are. So then, in addition to that, we went through and made videos on how to do each and every exercise, which was another labor of love. Trying to get these dogs to do the things and make it look doable. And, it's always working with animals is always a different level of challenge. But I think that the videos are going to be really helpful because you can read a description of a clamshell exercise and not really understand what that might mean. But when you see it, you're like, oh, okay, this makes sense. And I can replicate that with my patients.
Yeah, I just want to add, I think that's the real gem of this book is every exercise that's mentioned in a book has a link to a video that demonstrates how to do the exercise. And that's not been done before. And I think that's going to be a game changer for especially early practitioners, but also some of us that have been doing rehab for a long time. And I honestly discovered, oh, I didn't know there was this different way of doing that exercise. So it really is eye-opening when you see the video, because again, in words, you can envision something, but then when you see it actually being performed, it gives you so much more valuable information.
I mean, I can see this being an amazing resource for all vet rehabbers, but especially actually for the new grad that is opening up their practice. Because as you said, Jennifer, like, normally it's all around these modalities. And there are often these vet rehab therapists that are starting clinics, they don't have the funding to buy all the modalities. And this basically gives them, access to information to be able to do exercises and do it really well. And actually, interestingly, I interviewed a girl today from Australia, and her practice is actually centered around exercise. That's what she does. She doesn't have an underwater treadmill, she doesn't have a laser, and everything is about exercise. And she said she had to make a decision. She could either have all those things, but she felt like she was getting better results, basically empowering the owners and being able to do the exercises with them and get them to do them, because often the people in the area just didn't have the funding to be able to come for continuous rehab therapies and modalities and things like that. And she says she gets different types of people, some people that just come like 3 times a week for her to do them, and then others that come once every 2 weeks or once a week. But I can really see this being such a valuable resource, because for those new grads that are just feeling a little bit lost, here's an area which they can really, really dive into and be really, really good at it without having to invest in any modalities. They actually know all of this, but it's a resource that's putting everything together and putting it into a place where they can actually use this in day-to-day practice.
Yeah, that's exactly right. And the example that I like to give is if you've ever seen a physical therapist, how often did you go in an underwater treadmill and get laser therapy? That's not what you get. The way that you get results and recovery from an injury is by doing exercises. It's functional movement, and we're really trying to mirror that. And yeah, there's no mention of modalities in our book because you don't need it to return to recovery.
One other thing I wanted to mention that is pretty unique also about the book is I was pretty adamant about trying to maintain a very particular style to our book, and we really wanted the book to be as accessible as possible. Ready, like right off the shelf. We wanted it to be not your fireside reading where you're learning about the background and all the literature behind things. We wanted it to be a go-to point of care resource that there's actually a good portion of the book, a good percentage of the book is actually a list of conditions written very similar to the style of the 5-minute veterinary consult. So let's say if you have your first ever patient with fibrotic myopathy, you could flip to the book to the section on fibrotic myopathy, and it takes you step by step from details about etiology, pathophysiology, assessment, what they look like on exam, then what to do with the patient in a stepwise fashion. And so I wanted it to be very clinician friendly and to walk you through the process so you weren't having to flip back and forth and pull 5 different resources off the shelf and then come up with your own plan in the end, as we often have felt like, I think, in rehab. And even the chapters about athletes, for example, I really, or other types of animals like working dogs and the orthotics and prosthetics, I really wanted there to be a clinician-friendly perspective. And so the chapters are not only telling you about athletes, but they're telling you about what to do with these athletes. Let's tell you how to make a conditioning plan for a patient that is looking to go into herding, for example. So it's meant to be kind of like give you the building blocks to start putting this together yourself. And I can say personally from even though I'm a board certified specialist, I don't see every single kind of rehabilitation patient in a huge population. So this is actually the book that I would want to have as a reference as well to help me with some of those patient types that maybe I don't see on a regular basis.
I'm now understanding why it took 4 years to make everything that's in it. It sounds amazing. I can't wait to get one. So the big question, did you enjoy the journey of authoring and publishing a book?
So a lot of it I did enjoy, I can say, and I enjoyed, I think the biggest thing I enjoyed getting to know all of these amazing contributors and hearing from their minds, learning a lot from them. Basically, I've learned so much through creating this book and basically creating the resource that I always wanted to have and being able to share that with others. I think that is just that is so incredibly rewarding. And our book is just breaking right now, so and I'm just starting to hear feedback from rehabbers out there. I was just at Chi University doing some education, and a bunch of the attendees bought the book, and it just makes me so happy to hear that they feel like this is their go-to resource now, because this is exactly what they've been looking for to complement all of their learnings that they are doing on the side. And that's basically what I was finding, is there was a gap between, we have these resources that tell you about rehab, and then you go to all these different lectures and different places in CE programs that teach you the practical things, but then the practical things were just never written down. And so that's what this is meant to be, a companion for that in-person training.
Yeah, I would say that.
Anyone else?
Yeah, I just wanted to add that it was definitely a labor of love. At the same time, it was probably one of the best experiences, professional experiences in my career, in that, just as Jen said, we were able to personally work together with other leaders in the field. Cindy Otto, for example, also Alice Baker, and the work that she does with sporting dogs, and just learning even just the lingo, that the terminology that's used, with Patsy. I mean, some of these authors were also so passionate about what they were doing and making sure that we were getting it right, and just really learning from their perspective things that we didn't realize we weren't doing it in the best way. So it was really truly one of the best professional experiences, and even though it's a lot of labor, I would say it was 100% worth it.
Yeah, it was like the ultimate group project. Think back to high school or college, and what was amazing about this group project is everybody contributed, everybody pulled their weight, and that just goes to show the level of integrity and professionalism and attention to detail that those of us in this community have. But also, what I loved about it is, I'm a practitioner. I am in Southwest Missouri, right? And so sometimes I feel like I'm kind of on this little island and I'm just doing my thing. And what was great about this was, it really brought the community back to me again. I teach, and I'm giving out knowledge in person, and then the people leave, and then I go back to my practice, and it's just having this collaboration with my peers and my mentors and my heroes, and it's just one of those things that it just feels kind of full circle, and really, really I didn't realize that this was kind of a bucket list situation for me until on the other side of it, it's like, wow, we did that, and you see the book, and I mean, it's beautiful. The cover's gorgeous, and you see your name next to these other amazing women scientists. It's just inspiring to me, and I hope it's inspiring to other people as well.
I definitely think it's going to be. I mean, so if you've got any advice for anyone else who wants to think about authoring a book, what would you give it? What advice would you give?
Well, I'll start and just say that I think it should be something that you're passionate about, because it is such a labor of love. So if it's something that you're just like, this might be nice, you'll give up. You might give up. So make sure it's something that you really, really feel passionate about. And what the idea that she had to start this book was, hey, this is something that I wish I had in my day-to-day practice. So that's, if you're having a struggle with some gap of knowledge, everybody is. So if it's a question that needs to be answered, and you want to know what is the answer to whatever that is, that's probably something that everyone's struggling with. So that's a good point to think about what would be a good topic.
I have two pieces of advice. The number one most important is you must have somebody super organized on your team, and that was Jen. Somebody who's going to keep you on the deadlines and make sure that you are on task. Because without Jen, we would have not completed this project. Number two, I would say, is do a deep dive on the current literature related to the topic that you're interested in writing a book on, because that was really helpful for us to see what we liked, what we didn't like, and really help to structure how we wanted our book to be, and really understanding. Because, for example, we knew the big books, but we discovered a couple of other ones that were lesser known that we were like, oh, actually, this one, did this well. And so that was really helpful. But most important, I think, is who you pick to be on your team. It's really important.
It's like who you marry, also very important.
Yeah.
So are there any other textbooks in the future that we should be, well, maybe that you're going to tell me about, that's not going to be a secret?
Well, I mean, we're already, taking feedback for our second edition. And, of course, our second edition probably will include more things and be even and bigger and better. But I don't have any big textbook plans otherwise. This has been my baby for a very long time. My second baby. Both babies at the same time. So, but I will also say too. What's that?
Yeah, you carry on.
Oh, I will also say, it's important to write about what you know, especially for the audience, right? So you're thinking about who your audience is. Our audience is people that are learning rehab for the majority, are also learning rehab for the first time, and to be able to relate to them. And I think that was when we actually sat around, we thought about it, we're like, this is one of the very few textbooks that's written by, we have 3 board certified specialists. Not only that, but we also are doing rehab on a regular basis and educating new rehabbers. So we know exactly, and actually I'm educating vet students too. So we know exactly what the fresh mind is like and how to speak to the fresh mind, and how to make things relatable, understandable, and also practical. We even have sections on how to organize your medical records to incorporate rehab things. We have templates for medical record keeping. So all of these things that I knew in my mind, I wish that I'd had. So I think that really gave us the right voice to be able to speak to the audience.
Well, I just wanted to say you guys are an absolute inspiration. So I'm not sure if I'm going to be authoring a textbook, but I'm sure you've inspired other people too. And yeah, we just think you're amazing, the 3 of you, to do this and to hear how long it took. Really is amazing to even think that you're even thinking about another edition now. But yeah, it's just congratulations, and yeah, we're so excited. I'm so excited to see it. I can't wait. So even when Cara showed the book now, I was like, oh, I want my copy. So where can we get a copy?
It's available on Amazon and on Wiley.com. So,
okay,
probably most people are getting it from Amazon. And it's actually sold out already. We sold out in the first week that it was out, which we were surprised and super excited to hear. So it's going to be a few weeks before the next batch of books are going to be available. Yeah, so it's going really well.
You know that if we order on Amazon, nothing comes to South Africa. We don't get them.
So maybe Wiley. Maybe Wiley might be an option.
But I'm coming to the IA conference, so I'm hoping I can get one there.
Yeah, definitely in the US, you can get the printed copy. I just wanted to mention also the book is available for digital copy. So that's been really helpful internationally.
Nice.
If you can't get a physical copy internationally, the digital copy is
I'm a
available.
textbook kind of girl.
Yeah,
I like to.
yeah.
I like
we are
the
too.
book.
We are too.
Yeah.
I just want to say, Meg, thank you for those inspiring words, and I just want to say that I think you are so inspiring. The way that you have brought rehab practitioners across the world together is very inspiring, and that's really, I think, the most exciting part about our career is these amazing, phenomenal working mothers. All of us, right? All of us here right now, we are all working mothers doing great things professionally. You are so inspiring, Meg, and I can't thank you enough for everything you've done for our rehab community.
Oh, thanks, Leilani. It's so lovely to have the three of you here. And congratulations. And I look forward to getting my copy soon.
Thank you for having us.
Thank you so much.
Thanks, guys. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free. So go and check them out at pawprosper.com. And also don't forget to bookmark the next Vet Rehab Summit on Saturday, the 14th of November, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehab community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.